You heard a lot about this, so I won't belabor it, but the contemporary approach to quality is about system design and organization. It's not so much about how smart you are and where you went to school. There are proven processes. There are things that can and should be automated. You've all heard about the aviation industry as the gold standard, and that the maintenance person can shut down the flight because this is a team and people are empowered. And all of these things are the keys to excellence, and we're starting to get there in healthcare. We've got the quality councils across the country. We have a lot of plan, do, study, act cycles. Lots of interesting things going on in your LHIN, in this area and elsewhere. But it's still pretty early in Canada, and by international standards, we're still in the early phases. So we have cultural barriers to change, and these again are some of them. And again, I don't put them up here to throw them in your face. I think though that we have to confront them. We have to deal with them because they're there. When you look at the increasing credentials and people being educated in healthcare, each profession wants to carve out its own theoretical identity, which you can understand from a certain point of view, but it's very difficult for people with different theoretical presumptions about health, wellness, and interventions to act as a coherent team, because teams, effective teams, have the same values. So we need to figure out whether there is a meeting of the minds here. There are the traditional gender roles. They're changing, mercifully, particularly in medicine, but it's still the case that most other professions are female-dominated. We do evaluate, when you look at professional development over the centuries and what got to define a profession, autonomy and self-organization and self-regulation were the pinnacles of professional identity. And now we're trying to get people to say, autonomy is not what you want. You want teamwork and interdependence and co-management and the use of multiple skills. You want to lessen the importance of your own particular identity, not heighten it. Well, that's a very difficult thing when you're sitting on top of literally centuries of professional development, and this isn't just healthcare, it's in every human profession. And all these other things as well, and we do have a population that has come to believe that healthcare is, even though they understand the population health argument and they understand the social determinants of health, people still, if you ask them, well, you could judge by what people want by what they donate their money to. They give a lot more money for the MRI campaign for heart disease and cancer than they will give to a home care program. I don't see anybody donating money for geriatric fellowships, and I don't see anybody donating any money for a frail elderly at home visiting program. But everybody will give money for a building and a thing. So the public is pretty dependent on this high-tech wizardry that we've got going here. And I'm a little obsessed with the subject of identity, so forgive one more slide on this. And I won't belabor it anymore. But I do think it's an issue about how we define ourselves and what is our identity. An identity as a member of a system is a different identity than a grudging member of a system. Or if your identity is profession, fiefdom, corner of the system, program first, and public system second, we're going to get those predictable results that Berwick talks about. So I think we need to have a conversation about identifying. One of the hardest things that regions have found elsewhere in the country is how do you get people to truly identify with the system, the geography, and the population at the same time as holding on to that admirable desire to serve individuals. It's really hard. And I don't think it can occur spontaneously. I think you have to develop a strategy for doing it. So on the cultural scene, again, I think this is a rather crude attempt to summarize where we've been and where we're going. But I do think it's a big difference. As particularly on the productivity end, you know, where we used to think in terms of activity and volume. And what we want to do really is get the greatest benefit for the least effort and the least resources. And this dual focus on individuals and populations, which is a very difficult thing for people to do, but I think is one of the cores of transformation. And that whole notion of cooperating instead of competing is pretty critical as well. Because you've heard so much about this today, I will be very brief about it, but suffice it to say that this is the core. Primary health care, and I think you've recognized it. I think your LHIN has been very active in promoting family health teams. I think you have some very innovative telehealth applications here. You are blessed, at least in total, with a relatively good supply of primary health care, primary care physicians. You've got a very innovative and uplifting experiment with the NOSM, the School of Medicine, which I was happy to visit with the Health Council last September. So there's lots of good things going on here in that regard, and this is where I think you can be a leader in the country. If you succeed in transforming primary health care with an expansive interdisciplinary model, to a greater extent than appears to be the case in most other parts of the country, I think you will see transformation acquire its own momentum, and you won't even have to think about it anymore. If you can get to Tabor Plus as quickly as you can, then you will find an amazing liberation of both resources and of the public that is enabled to look after itself better. And conversely, if it is difficult to achieve, I think it's still going to be the same battle that the rest of the country faces, which is you're trying to deal with the consequences of failure. It will require so much attention that you won't be able to affect the transformation. So what can we do, and what should we do? Well, a few things come to mind. First of all, this sounds simple, but it is remarkable the extent to which Canadian incentives are not aligned with the goals that are built into legislation, built into integrated plans, including yours and so on. So I think it is very important, however trite it may sound, to declare what we value and communicate it to communities. I don't think we're very clear in healthcare about what we value. We say we value population health, we say we value upstream interventions, we say we value self-reliance, we say we value interprofessional practice, but do we actually walk the talk? And it seems to me the way we walk the talk is to take several avenues to that alignment. You have to affirm it, you have to have incentives, and they're not all financial. You have to support those who are participating in the change you want, and you have to encourage them. And if that means that you have young, relatively new people promoted to positions of leadership instead of just doing the natural hierarchy of things on a seniority system, some brave personnel decisions can create wonders. Leadership is critical here, and I think you have to find out who your young leaders are and your younger leaders are and let them run with this kind of stuff. I think it's extremely important to discourage what you don't value. I mean, I think we do now have some incentives for trying to get the things done we want, but we don't actually get rid of the stuff that isn't very helpful. So, if we don't like assembly line practice, where you have a patient visit of 3 minutes that ends in a prescription, then you have to find a way not to make it so lucrative. If you don't want a system that continues to overlook avoidable errors, you have to find a way not to make it lucrative. The US Medicare system, which is its system for the elderly, has just said that they're going to quit paying for 8 avoidable errors in hospital. So if you stay an extra day or two in the hospital because you have bed sores, the hospital won't be reimbursed for it. And there are 7 other conditions like that. They're trying to send the signal that it's not okay to not improve. And if you don't improve, fine, but we're not going to reward you for it. It's going to hurt you financially. It's not going to help you. And of course, one of the jobs is to look at what the provincial policies are. If there are provincial policies that you identify at whatever level you are in the system that get in the way of doing the right thing and that align incentives with goals, speak up. I think you need to involve yourselves in that policy process. There are things to watch out for and things to embrace in this journey to transformation. And I think, again, Dr. Folletti's talk was a perfect lead into this, and so were the other two, frankly. Understand the problem before rushing to a solution, and don't accept conventional views of the problems without examination. And you may have a values and interest problem rather than a technical and a knowledge transfer problem. You know, we've been trying to kid ourselves that all we need to do is make guidelines available, have user-friendly research reports, have portals for people to look at data, and that will make the world a better place. Well, the world is like it is for a reason, and some of those reasons are values and interests. The status quo serves a lot of interests in the system, and change is hard. So if you do have an interest issue to deal with, I think we need to find strategies to deal with it. We need to get people in the room and talk through the values and interests, and if we identify things that aren't in sync, there are ways to deal with that. I mean, there are ways to mediate fundamental problems and fundamental issues here, but glossing over them will not get the job done. Innovation, as I've said, is not a Canadian problem. Spread is. So whatever you do, whenever you innovate, I think it's very important to work on the spread strategy, which is a combination of leadership, financial incentives, measurement, and reinforcing the behaviors you want.